action.
This is going to be the trauma assessment. Trauma assessment could be anything with a significant mechanism of injury, such as a car accident, a fall, a geriatric person falling out of bed, a slip, trip, or a fall could end up being a trauma. So you're going to manage your patients a little bit differently than you did in the medical assessment. Step 1 is going to be scene safety, BSI.
Step 1 and 2, BSI taken, checks for scene safety.
Scene is safe.
Step 3 determines mechanism of injury.
For this, we're going to say she fell, and she's complaining of she fell 30 feet, and she's going to be complaining of leg pain. And this assessment, before I get too much farther, the medical assessment and the trauma assessment, you have to be very hands-on with your patients. You have to be able to assess your patient accordingly. As long as you do it in an appropriate manner, it's usually tolerated by your patient.
Step 4 determines number of patients.
We're going to have one patient here.
Step 5, request additional help or resources if necessary.
Based on the mechanism of injury, she fell 30 feet. We're going to call ALS for shock management and fluids.
Step 6, consider stabilization of C-spine.
I'm going to have my partner take up manual stabilization of the C-spine.
Step 7, verbalizes general impression of patient.
Just a very quick scan of the body. I'm going to notice she has a broken leg here. She's got multiple cuts and bruises and abrasions up on her facial area. A couple lacks down through here.
Step 8, determine responsiveness, level of consciousness of patient using the AVPU scale.
Hey, you okay? I'm going to see if I get a response from that. If not, I can do a sternal rub right here.
Step 9, determines chief complaint or any apparent life threats.
We're going to make our patient unresponsive just because this will work a little bit easier. So my chief complaint, again, leg, arms, facial area.
10, airway assessment.
Going to do the head tilt chin lift to open the airway. If it was a significant trauma to the neck region, I would do the modified jaw thrust. But for this way here, we're going to do the head tilt chin lift to open the airway. We're going to look, listen, and feel for breathing, making sure you're looking down this way at the chest. You're going to look, and you're going to look, listen, and feel. You're going to see if you can feel some breathing on the side of your face. You're going to open the airway and look for blood, vomitus, or any secretions inside the mouth.
Step 11, airway simulation of insertion of a OPA or a NPA.
We're going to measure an oral pharyngeal airway for the unresponsive patient from the corner of the mouth to the tragus of the ear, and we're going to insert it appropriately to manage her airway. Then I'm going to ask my imaginary partner, my third person, to apply a bag valve mask to hook up to 15 liters per minute, and they're going to bag her at that rate because she is unresponsive.
Step 12, breathing initiates O2 and assures adequate ventilation, which has already been done. Step 13, breathing injury management.
We are going to expose the chest. We are going to palpate the chest, looking for open pneumothorax, flail sections. We're going to look for JVDs here, tracheal deviation. We're going to look for tracheal deviations and JVDs. We're going to be assessing the chest to make sure it's good equal rise and fall, make sure we're issuing adequate ventilation. We're going to be looking for any flail sections through here.
Step 14, circulation, assessing the pulse.
Going to do a carotid pulse on the medical patient. I'm just demonstrating it here for purposes, but you want to make sure you do it on the same side towards you. Find the center of the neck, fall into the groove.
Step 15, assess for and control any major bleeding. This is also known as the sticky test.
I'm going to do just a very quick head to toe, making sure I look for and control any major bleeding.
Make sure you're checking your gloved hands every few seconds to make sure. You don't want to get through the entire assessment and then look at your hands and see that you have bleeding. You may not know where it comes from. Step 16, again, circulation, assessing for skin color, temperature, and condition.
With my partially removed gloved hand, I'll discuss skin color here. You can do it on the neck, you can do it on the arms. Try when you're assessing the skin color to keep it to the center or core of the body. Worst comes to worst, you can lift up their shirt a little bit and go like that.
Step 17, identifies priority patient, makes transport decision.
We're gonna load and go because she's a priority patient with a leg injury.
And step 18, selects appropriate assessment, either a focused or a rapid.
Since we want to load and go, we're going to select a rapid assessment. Since I've already cleared the neck, I'm going to have my partner put on a C-collar, so her neck is now collared. So when we go to roll the patient to get her onto her long spine board, we can do that. And I realize on your sheets, the long spine board is at the bottom. However, when you're doing a rapid assessment and you're going to be loading a patient onto the spine board, you can move that step up to where it was before. Because every change in the skill sheets, they either have it way at the bottom or way at the top. So for practical purposes, we're going to move it back up at the top. I've already done my sticky test. I'm going to call that my rapid assessment. I can do it again if you want, just to make sure I didn't miss anything. My
Step-
partner's count, we're going to roll her. Go ahead.
You can continue, that's fine.
On my partner's count, we're going to roll her towards me, and we're going to check the back. We're going to clear the back, clear down through. We're going to stick a spine board under her, and we're going to roll her back onto the spine board to initiate transport.
Step 19, obtains baseline vital signs.
I'll put my blood pressure cuff on and take a blood pressure. For this to work, we'll do 90/60. I will check a heart rate. We'll call this 60. And I'll do a respiratory rate. We're bagging her, and we're going to be bagging her 12 times a minute.
Step 20, obtains a sample history.
For the unresponsive trauma patient, sample history will be deferred.
Step 21, inspect the head, palpate, scalp, and the ears.
I'm going to check the head. This is where you want to actually run your fingers through. You're going to be looking for DCAT, BTLS, bumps, bruises, deformities, contusions, abrasions, lacerations and swelling. You're going to inspect the eyes. You're going to inspect the orbits. You're going to inspect the facial bones. You're going to inspect the neck. Make sure the trachea is in the midline. I think I skipped a couple of steps ahead.
Yep, that was steps 21 through 26. Steps 27 through 29, inspecting, palpating, and auscultating the chest.
Going to inspect the chest, same thing, here and here. I'm going to listen to lung sounds, mid-clavicular, mid-axillary. Make sure when you're doing this, you compare one side to the other.
Steps 30 through 32, the abdomen and the pelvis. You're going to assess the abdomen, assess the pelvis, and verbalize the assessment of genitalia as needed.
I'm going to palpate the abdomen in 4 quadrants. I'm going to come down. We're going to assess the hips in and down. We're going to verbalize the assessment of the genitalia.
Steps 33 through 36, you're going to assess the extremities. Right leg, right arm, left arm.
Where I just went like this in the past, I want to actually go through the leg and check all throughout here. We're looking for DCAT BTLS on each of the leg as we go down.
Steps 37 and 38, assess the posterior thorax and lumbar areas.
We've already done that when we put her on the backboard. Again, they move this around the sheets all the time. Oh, we didn't do the arms. We're gonna make sure we assess the arms. Again, make sure you're going around the arm and assessing for DCAT BTLS.
Steps 39, manage any secondary injuries or wounds that are found.
We did the open leg injury here. I'm gonna bandage up her cuts on her arm, maybe her face if it's bad enough, to control bleeding.
Step 40, verbalizes reassessment of vital signs.
I will check another blood pressure. We're gonna say it maintains 90/60. I'm gonna check a pulse rate again. Trauma patients, you can either check here, you can check here if you want, but it's not recommended, or you can check the femoral pulse, which is right here where the leg bends at the hip.
And to complete this station, you have a 20-minute time limit, and that is your trauma assessment.